Honorable Ministers, the guest of honor, Honorable Minister of Health, Honorable Kumbize Kandodo Chibonda MP, Minister of Finance, Honorable Felix Mulus, Minister of Justice, Honorable Titus Imvalo, Senior Counsel, Minister of Education, Honorable Agnes Nyalonje, UN Country Rep, Mrs. Marie Torres, members of diplomatic corps, His Excellency the British Ambassador, but also a co-chair of the Presidential Task Force, Dr. Wilfred Chalamila Nkoma, members of the task force, Your Highness Inkos Yamakos Mbewa 5, Secretary for Health, Dr. Charles Mansambo, Chief of Health Services in the Ministry of Health, Mrs. Dr. Queen Dube, UNICEF WHO Country Rep, all protocol observed. Good afternoon. I know it's a happy afternoon, having received the vaccines. We are not here to waste much of your time other than to receive the vaccines. But Honorable Minister, allow me before we start our program this afternoon to invite Mrs. Temwa Zengeza from EPI to give us a thank you prayer.
Let us bow our heads and pray. Our Heavenly Father, we want to come before you this afternoon to praise and glorify your name. We are full of joy and thanksgiving, Father. We have received the COVID-19 vaccine, the long-awaited vaccine. We are very hopeful, Father, that with this vaccine, we are going to control the pandemic that has hit the world and not sparing us. Father, we know the vaccine without you is nothing. That is why we are giving this vaccine into your hands. Father, bless us. Give us the energy, the wisdom that we need so that we can do this work of administering these vaccines to the eligibles until, Father, we attain what we are looking up to. We ask all in the name of your Son, Jesus Christ. Amen.
Honorable Ministers, or members of diplomatic corps, UN family, once again, Honorable Minister, welcome to Kamuzu International Airport. Vaccine. Without taking much of your time, Honorable Minister, as you are aware, the vaccine is coming under COVAX, and the UN family contribute a lot to the COVAX arrangement. So allow me, Honorable Minister, to invite the UN resident coordinator, Her Excellency Maria Torres, to give us a remark, but also I will invite her to invite two members of the UN family to have their brief remark. Honorable Minister.
Good afternoon. Is it working? Good afternoon. Good afternoon, Honorable Minister of Health, Minister of Finance, Minister of Justice, Minister of Education, and the Chief who is representing the traditional authorities, members, senior members of the government of Malawi, and international community here present. My colleagues from the UN team, WHO, UNICEF, I have very few remarks because we just want to mark the importance of Malawi being the 10th country in Africa receiving the vaccine. So there must be something that we have all been doing right, please. And I think we need to applaud the work that has been behind all these efforts. And Honourable Minister, really thank you for the dedication of your team, the professionalism. And honestly, also, I want to thank the UN team for their sleepless nights, also working hand in hand. Thank you very much, colleagues. Rosa, for this absolutely work. I want to start by saying that we are here today representing not just Malawi, but the international community in a very important message. We need to stop the virus. It's not enough that we stop the virus in Canada, we also need to stop the virus in South Africa, in Fiji, in Indonesia, in Colombia, and of course in Malawi. So the fact that you are here doing this, really tremendous recognition. Second point is there has been so much discussion about the unfair access of different countries to the vaccine, and today we are seeing precisely the bright side of international cooperation and solidarity. COVAX is exactly that. It's member states coming together to say we are going to together fight the virus. And I just want to have a moment to thank colleagues of the international community here, the UK, Norway, I know we have India, I think countries that have contributed with their resources and vaccines for this to be possible. So thank you very much, because this represents exactly what the UN is about, is solidarity, work together, disease and win over the disease. So the target is not just this first installment. The target is really to get safe from the virus. And I think this is where we are working together. We are here also to realize that COVID is health, but it has also had catastrophic impact in the socioeconomic fabric of the country. The Minister of Finance is working non-stop to get Malawians a budget that can also continue serving the social sectors. It's really very tough. I just want to say that the way in which the UN has been working to accompany countries, particularly Malawi, in stopping the virus last year and this year is the topic for the UN country team. And we will continue really partnering with national entities, civil society, the media, to spread the voice that is important to stop the virus and therefore to continue to prevent and get vaccinated. So this is a great example of how SDGs continue to promote the development agenda, and it's always very important to remember that it should be people-centered. So we are here to save the lives of the health workers because they are the ones who can help saving our own lives. So I think that's the logic of the first phase, which is absolutely amazing. And absolutely, my last point is really to thank my colleagues from UNICEF and from WHO, because they have played an amazing role globally to make sure that COVAX was operational. So thank you very much, colleagues, and thank you for this opportunity. Maybe I think UNICEF was coming first and then Rose.
Thank you. Thank you very much. Honorable ministers, high commissioners, ambassadors, heads of corporations, the resident coordinator, UN colleagues, Your Highness, I think I'll leave it at this. All government officials, all protocols observed. Ladies and gentlemen, good afternoon. So it really fills me with tremendous pride to be standing here today. It was such a happy moment to see the plan land on Malawian soil. So it's a very special occasion as we welcome the arrival of the first ship. And we are very pleased that Malawi is one of the countries in the region to receive the first batch of the vaccines from the COVAX facility. And I must congratulate the government of Malawi, especially the Ministry of Health, for the tireless work really very, very special, tireless work that went on behind the scenes, not even visible to the public, to make this happen. It is a testimony of your relentless efforts to protect the people of Malawi. After a year of disruptions due to the COVID-19 pandemic, with more than 32,000 Malawians infected with the virus and over 1,000 lives lost, the path to recovery for the people of Malawi can finally begin. This arrival of the COVID-19 vaccines is a critical step to bring the pandemic to an end. At the global level, we have to ensure that COVID-19 vaccines are affordable and accessible to all countries. Vaccination should be available all around the world, and people from less wealthy countries cannot be left behind in the efforts to be protected. At UNICEF, we are fully committed to making this happen. The 360,000 doses of the AstraZeneca vaccine that's coming from the Serum Institute of India represent part of the first allocation of COVID-19 vaccines, headed to several low and middle income countries. And Malawi has been allocated a total of 1,260,000 doses of this vaccine, and the remaining quantities will be delivered in the next few months. As the largest vaccine buyer in the world, UNICEF globally is coordinating and supporting the procurement, international freight, and delivery of COVID-19 vaccines for the COVAX facility. And these shipments represent the beginning of what will be the largest vaccine procurement and supply operation in history. Globally, the COVAX facility plans to deliver close to 2 billion doses of COVID-19 vaccines this year. This is an unprecedented global effort of all of us, everybody here, all the donors, all the governments, all the partners, development partners, to ensure equitable access to vaccines for everyone. Additionally, UNICEF will procure sufficient quantities of syringes and safety boxes this year and ensure that these arrive in countries before the vaccines. Malawi has already received 360,000 syringes and more than 3,600 safety boxes to initiate the vaccination rollout. We thank all partners present here that are supporting the COVAX facility to deliver safe and effective COVID-19 vaccines to all countries in need. As part of the UN country team in Malawi, UNICEF reiterates our full commitment to support the vaccination campaign and contain the spread of the virus, in close cooperation with all partners, including WHO innovations. Ladies and gentlemen, vaccines save lives, and this vaccine delivery is a major achievement. But ultimately, vaccines will only protect us if they are effectively delivered to the population. UNICEF has therefore also provided technical support to the government of Malawi to develop the National Vaccine Deployment Plan. And in addition, we have assisted the Ministry of Health in mapping out cold chain capacity and identify gaps to be addressed to ensure the safe storage of the vaccines. And as per the ministry's request, UNICEF has installed 2 additional walk-in cold rooms in February to address the gaps identified at the central level. I am personally very much looking forward to seeing now health workers and other frontline staff getting vaccinated in the coming weeks, which will be the first step towards a gradual return to normalcy for all of us. Lastly, let me reiterate what our UNICEF Executive Director recently said. Vaccines arriving in the country represent hope for our children. Their access to education, health, and protection services has been severely disrupted by the pandemic. As vaccinations roll out, this will help to bring the pandemic under control so that we can start the work to build a better, safer, and healthier future for everyone. End of quote. And today is a very good day for the country, and I'm personally very happy for the people of Malawi. Thank you very much. Sikomo.
Thank you. Good afternoon to our Honourable Minister of Health, Ms. Kwagwanji, and good afternoon to all Honourable Ministers here present, I wish good afternoon to all members of the diplomatic corps, our UN colleagues, distinguished guests, and members of the media, all protocol observed. Now, being the last speaker, I must say, I'm not going to repeat all the things that have been already said, but just to quickly bring in what you asked as the WHO would like to bring to this gathering. I'll start off by a quote from our regional director here in Africa. Her name is Dr. Matsidiso Moeti, and she says, the COVAX facility has begun to bear fruit. We've seen the fruits today. We are witness to that. And today is truly a joyful day for all of us here. I wish I could ululate, but I need to talk. Yes, thank you. Yes, so that brings the mood of the day to life, yes. So WHO acclaims and congratulates Malawi for preparing the country for the deployment of the vaccines whose arrival we have witnessed today. We're all witnesses here, aren't we? We saw it with our own eyes, yes. And then WHO also reiterates the purpose of the COVAX facility, and that is to ensure fair and equitable distribution of COVID-19 vaccines, regardless of a country's wealth status. The deliveries mark the start of what will be the largest, most rapid, and most complex global rollout of all vaccines ever known in history. So we're making history, okay? Right. And now that the vaccines are in the country, it's so important to quickly start vaccinating the intended recipients. Remember, the vaccines mustn't stay in the cold room. They mustn't stay in the boxes. They must go into people's arms. Yes, that's what we now need to move very quickly with. And as WHO, I pledge our support that we are there to continue supporting this most important endeavor. You can see we're here in full force. We're all in our regalia, ready to go to the forefront. So thank you very much. Thank you.
Thank you very much, UN family. Honourable Minister, you heard a speech from Rudolf Swenk. He is the UNICEF country rep, and the last one was Dr. Nola Jamin, WHO country rep. Honourable Minister, allow me also in a special way to recognize the presence of Mr. Mazigo Matimba, who represents the civil societies which we're working with in the health sector, but also we can't do without our heroes, the frontline health workers. And in our midst, we have Dr. Victor Miti, who is the president for Society of Medical Doctors. Honourable Minister, as I said earlier on, this is not an event of speeches, but allow me to invite Secretary for Health, Dr. Charles Mwansambo, who is going to give us a few remarks, but also I'll urge you, SH, to invite Honourable Minister to address us this afternoon. SH.
Thank you very much, Joshua. Let me recognize the members of the Presidential Task Force present here today, led by the two co-chairs, Honourable Minister of Health and Dr. Chalamila Nkoma. Let me also recognize all the members of the diplomatic corps present here, the regional, not regional, but the country coordinator of the UN and all the members of the UN present here, my colleagues from government, members of the media, ladies and gentlemen, good afternoon. You can see me stumbling on my own words because I'm very excited. Very excited. This day is finally here. My noble task this afternoon is to request Honorable Minister of Health to address the gathering, but at such a function, you can't avoid saying a word or two. The vaccines are here, yes, but I just want to emphasize that this is one of the tools in our fight against COVID-19. So the fact that the vaccines are here doesn't mean that we should relax. I think let's continue washing our hands regularly with soap and water, and of course those that with sanitizer, use sanitizer. Let's watch that 1 meter distance and avoid crowds. I hope you in the media are watching the distance wherever you are. And also, let's make sure we're always wearing the masks. At that point, I'm too excited to say too much, so now it's my noble task to request Honorable Minister to address the gathering. Thank you.
Thank you so much, Secretary for Health. Members of the Presidential Task Force are present here, including the co-chair, Dr. Wilfred Nkoma, who is present here, the UN Resident Coordinator, Her Excellency Maria Jose Torres, and all our excellencies, ambassadors. Also, let me recognize the rep from the Indian High Commissioner. Also, let me recognize the WHO representative, Dr. Jamin, who spoke just a few minutes ago, and also the UNICEF country representative, Rudolf Schwenk, all representatives of our development partners, not forgetting the directors, deputy directors from the Ministry of Health present here. It is an exciting day for all of us. And also let me recognize the staff from here, the airport commandant, and all the staff members of the airport. Thank you so much for having us this evening. We really appreciate representatives from Allied Freight, the clearing agents of the cargo of the vaccines present here, members of the press, ladies and gentlemen, good evening. You know, they had written for me a very, very long speech, but I don't think today is a day for speeches. If anything, in terms of facts, everything, logistical issues, they have been well handled by Maria, our UN resident coordinator, and also by UNICEF, and indeed by WHO. From me as a Minister of Health, and indeed representing Malawi government, I only have 2 words. The first one is to say, today it is a great day. I'm so excited today. Why am I excited? Because today, in that box gives us hope. That box represents restoration. In that box, it gives us hope that one day soon, we'll have the opportunity to see our beautiful smiles on our faces. You know, in that box, there is hope that indeed soon we're going to shake hands. You know, Maria, in our culture as Malawians, when you have a child born, the first thing you teach your children, your babies, it is to greet a visitor or anybody who comes. That is the most important thing in each and every culture. You teach your children, when a visitor comes, you have to go kneel and greet. So you can imagine the change, you know, 180, 360 degrees, all of a sudden, it is no longer important. It is a culture shock. So in that box, there is hope that soon and very soon, we are going to shake hands, indeed. And also, in that box, you know, there is hope that we can attend huge gatherings of weddings, you know, we can do all these things. I'm excited because in that hope, there is hope for Malawi as a nation. Our economy has suffered tremendously Socially, we have suffered. As we're talking now, our minibuses, they're suffering. The capacity has been reduced drastically. They cannot make ends meet. Our sports, they have suffered up to now. There's no sports taking place. Our drama groups, our social sector has, suffered tremendously. So when I'm looking at that box gives me hope that indeed all these things I've talked about as a country may be soon, and pretty soon, sooner than we thought, it is going to happen. And for these very reasons, I want to thank you, especially the UN family. UN family, WHO, you have been there, our partners, different partners, development partners, our donor partners. You have been with us with this country from last year, March, when it appeared that indeed COVID was here in Malawi. You were there with us. As a country, we were not prepared. We did not have anything. In fact, we were just hearing about this disease from outside. We did not know that 12 months later, it is going to land in our country and cause so much devastation. As we're talking now, in the last 24 hours, we have lost five Malawians. To us, maybe it's just a number, and we're saying, no, the number is getting much better. But to somebody else, that 5, it is a parent of somebody, it is a colleague of somebody, it is a church member of somebody, it is a close colleague of somebody. So we should not look at numbers. To some other people, those numbers are putting faces. They're putting faces of their loved ones, and they're thinking that if this vaccine, maybe if it had come sooner, maybe we're going to save some Malawians. So that is why I'm so excited that at least with the arrival of the vaccine as a country, indeed we are going to save Malawians. So for those reasons, thank you so much, our partners. No words can describe how grateful we are. We have come to this position because of the collaboration, the interaction, technical support, financial support, and everything. So for that, we're very grateful. Let me also say sincere gratitude and thanks to our team from the Ministry of Health, headed by the Principal Secretary. Most of the times we Malawians, we forget to thank our children. We always thank the children of your neighbor. But today I want to thank my children. They have worked extra hard. And I know for them, this is just the beginning. Because we have received this vaccine, I want by the end of this week, I have to hear that somebody in Ichitipa, they have received the vaccine. I want to hear that in Iligoma, there's a nurse there who has received the vaccine. I want to hear that in Machinga and indeed in Isanje, in Ikameme Chitipa, in Chinjin Kodakota. I want to see photos as well that the vaccine has been distributed to all 28 districts of Malawi. With these very few remarks, I'm so excited. Thank you all, our journalists. Thank you so much. Don't worry, you'll not be forgotten. No, but my appeal to you, our journalists, please help us. Help the government, help the country, send the rightful message to the people. Let's avoid spreading false news. The vaccine we're receiving, it is a very safe one. It is a very safe one. Its efficacy is well known, and everybody else is going to get the same vaccine. Our president is going to get the very vaccine, the same one which has come, and indeed he's going to get it within this week, before end of 7 days. Our vice president is also going to get the same vaccines. Everybody else, including Inkosi Yamagosi Mbera, who is here, he is going to receive the very same vaccine. So let us please encourage people to come and get this vaccine. It is not mandatory, it is voluntary if you wish. But let's encourage people because we need as many Malawians as possible to get the vaccine so that we can reach the 60% which we are requiring. Have a blessed evening. Thank you so much.